welcome to those who had joined us today in our Facebook Live. So allow me to first introduce myself. My name is Aino Sahiza. I'm currently a charge nurse at Assunta Hospital and I'll be the moderator for this session. So before I introduce the speaker for today, just a little reminder. If you have any question during the talk, feel free to type them in the comment box below this live stream. I'll bring the question up during the Q&A session and they will be answered by the speaker. And also don't forget to like and share this live video with your friends and families so that they can join us and benefit from the live chat. The World Health Organization, WHO, has declared the COVID-19 outbreak to be a public health emergency of international concern. So people of all ages can be infected. Older people and people with pre-existing medical conditions such as heart disease, asthma, and diabetes appear to be more vulnerable to becoming severely ill with the COVID-19 virus. If you are living with diabetes, what is the risk that COVID-19 poses to you and how you can stay safe and healthy during the pandemic? So today we have the expert in this field to give us some insight of diabetes and COVID-19. So it is an honor to have with us today our consultant endocrinologist, Dr. Shalini Sree Dharan. She obtained her medical degree in 2005 from University Science Malaysia and passed her MRCP UK in 2011 and then pursuing her subspecialty training in diabetes and endocrinology under the Ministry of Health Malaysia. Before joining the private practice, she had worked 15 years with Ministry of Health at various institutions, including the Endocrine Department in Christie NHS Foundation Trust, Manchester, United Kingdom, and she also received her Excellent Service Award in 2010 and 2019 from Penang Department of Health and Kedah Department of Health respectively during her service in Hospital Sultan Abdul Halim, Sungai Petani, Kedah. So without further ado, let us welcome Dr. Shalini.
Thank you very much, Nika. And thank you everybody for tuning in the middle of the pandemic. I think it is rightly the right time to remind everybody that especially safe and healthy at this point of time. So without further ado, let me in. As you can know, I have already mentioned that this is an emergency. We are all in a state of emergency. This virus has caused us a lot. It has been almost more than a year, and two Hari Raya Puasas and two Hari Raya Haji has passed since it came and affected our lives tremendously. It has robbed many people of their family members. It has caused a lot of morbidity. It has affected the quality of life of many people, including myself and everybody sitting here together with me and yourself too. All right. So let's just go through how does this horrible virus has affected us. So as we know, coronavirus, as the name suggests, corona means crown. So it does look as if that it has a crown. Actually, if you look at the slides here, these are actually spikes. uh, it is there are many spike proteins surrounding it, and because of that, it looks like it's wearing a crown. And how does one get affected? Is because when this spike protein rests on the receptor called ACE2 receptor, it gains entry into our body, and when it gains entry, not only this stays there, it starts to replicate. So the release of the viral genomic RNA, which is something like a DNA for the virus, causes it to multiply in our body and form more viruses, and these particles will then be released from and therefore can transmit it to another individual. All right. So basically, coronavirus, this is a disease not only to the respiratory system, but also to the vascular system. Therefore, you can see once the virus gain entry, it disturbs the lung function. At the same time, the vascular system, here we call it the end. It has two mechanisms. One, it causes disruptions of the vessels. We call it the inner vessels, endothelial dysfunction, and it does cause increased coagulation. That means it causes clot to form in the blood vessel, and sometimes when the clot, it increases the blood supply to an organ, and therefore sometimes if it's supply to the heart, it's impeded, happens somebody get heart attack, and if the blood clots occurs to the vessel that supplies the lung, they can have what we call pulmonary embolism. So it's mainly virus entry, it starts to activate the immune response in our body. Okay, as you can see, as this virus entries, it activate the inflammatory response, and then what we call that when there is profound inflammatory response, we can call that a cytokine storm, and these storms activates cells that can cause endothelial dysfunction. At the same time, when there's so much cells being activated, it causes a condition called hypercoagulability. And when there's a lot of blood thickness increases in the vessel, it can form clots and it can damage the blood supply to the heart. And also, once the blood supply to the heart is compromised, sometimes blood supplies even to the kidneys are also compromised. It causes renal failure. So it does cause possible a multi-organ failure, and sometimes patients succumb to it because of this multi-organ failure. All right. So what are the symptoms? Okay. So usually in the beginning, most of us were not having much severe symptoms with this COVID. Okay. We don't have so many deaths. So many of the people are actually asymptomatic. But however, these asymptomatic people can still transmit the virus. All right. The average time from exposure to symptoms is usually around 5 days, but at times up to 14 days post exposure. Okay, so therefore, that's the reason why sometimes quarantine can go up to 10 to 14 days. Okay, common signs and symptoms include fever, dry cough, shortness of breath, and loss of taste and smell. So these are usually the presenting complaints to us as well. The fever sometimes will be high grade. The cough are usually dry, and usually shortness of breath occurs rather late in the disease. So now we have a condition called happy hypoxia, where the patient is actually having low oxygen concentration in the blood, but yet they do not have symptom of difficulty in breathing. Okay, all right. What are the complications? I've mentioned to you earlier that this virus affect mainly the respiratory function and also the lung, the vascular system. So obviously, lung injury is the most common presentation. So many of the patients that are in the intensive care or in the ICU or on ventilator, they are there because they have lung injury. Other possibility that this disease can cause is cardiac injury. Okay, sometimes it presents an acute heart attack, and this is due to thrombosis or thromboembolism. Sometimes even it can cause a stroke. Okay, when the systemic inflammatory response is overwhelmed, it uses up a lot of these inflammatory and coagulation cells. They can have what we call disseminated intravascular coagulation, where instead of having just clots, now we have bleeding. So this bleeding also is a sign of severe inflammatory response, and this can lead to multi-organ failure. So usually the organs that are failed, usually the heart, the lungs, and also the kidney. Okay. And if you have survived the severe COVID, sometimes there is some patient there is complication, what we call long COVID syndrome, where they will remain some amount of pulmonary dysfunction, meaning lung dysfunction, and they have some residual lethargy, and some patients may feel they no longer have the same fitness as they were prior to infection. Okay, very rarely patients have persistent loss of smell or taste. Okay, this is quite rare to be prolonged. Okay, now focusing on diabetes and COVID, answering the question, is people with diabetes more likely to get COVID-19 versus the normal people? The answer is no. The risk of getting an infection is equal. So somebody who's fit and who's probably very healthy is probably going to get it at the same risk as somebody with diabetes. However, diabetes is one of the high risk groups for developing severe illness from COVID. That means if they get the virus, what may happen is that they may have more symptoms and complications and more severe the disease compared to somebody who does not have diabetes. And if we know that there are two groups of diabetes, mainly the type 1 and type 2. Type 1 is diabetes where there is no insulin left in the body, so they are insulin dependent. Type 2 diabetes is a condition of insulin resistant, or when their body, they have adequate insulin, but however their body is not sensitive to the insulin, Therefore, sometimes they need medication to get the glucose to control. So that's the difference between type 1 and type 2. So they whether they are type 1 or type 2, the risk of having worse or severe COVID is similar. All right, so what do we know so far? So from the evidence worldwide, for example, in the beginning, actually what they found in the beginning was up to 19% of a cohort of 16,749 patients hospitalized with COVID-19 between just these 2 months had actually had underlying diabetes. Quite so, about almost 20% had diabetes of all those patients who needed hospitalization for COVID. And one third of people dying from COVID-19 in the UK had an underlying diagnosis of diabetes. Okay, that's quite a big amount, right? And the mortality is up to 50% higher in this patient population than in people without diabetes. So the chances of dying is 50% higher if you have diabetes versus those that do not have. And people with diabetes hospitalized for COVID-19 in France found that 29% of people attained a primary outcome measure of mechanical ventilator or death within 7 days of hospitalization with COVID-19. Meaning that if you have diabetes and you contracted COVID, you are categorized as high risk. So what happens is that these are the people that usually needs to be monitored closely or even hospitalized for close monitoring and treatment. All right. Another thing is 40% of people hospitalized with COVID-19 in the USA has underlying diabetes or hypoglycemia. So some of the patients are not aware that they have diabetes. So when they come to the hospital and when they are sick, their sugars usually goes up. And when the sugars are high, the mortality, if you're not treated, there is up to more than fourfold greater mortality than those with normal glycemia or normal glucose level. In short, people with diabetes are higher risk of one, being hospitalized and needing ICU care, needing intubation, and even dying due to COVID. And usually people with diabetes, they don't just have diabetes. So sometimes they are obese. That means they are overweight and they probably are even at the category of obesity. They may have hypertension. So up to one third of diabetic patients are actually having coexisting of other medical conditions such as hypertension and dyslipidemia. And if they are in the older age, usually their risks are higher compared if they're younger. And if they are type 2 diabetes and they're obese, sometimes they have a pro-inflammatory state where they're, because of the large amount of fat cell in the body, as a people with a large amount of fat cell has more inflammatory cells. So this also predisposes them to have severe COVID. And if they have underlying lung problems such as chronic obstructive pulmonary disease, so these are those risk factors for getting COVID, severe COVID, and sometimes even mortality. Okay, and there is also the importance, what we discovered from a lot of patients who are hospitalized with severe COVID. Many of them actually have a very low vitamin D level. So for now, usually what we usually recommend to everybody to improve their immune system is taking supplements such as vitamin D and C, right? All right. So what I've mentioned before, or if you have more comorbidities or disease that you are living with, the prevalence of this infection to become severe is higher. So a meta-analysis of 8 studies with 46,248 COVID-19 patients showed that most prevalent comorbidities are hypertension, diabetes, heart disease or cardiovascular disease, and respiratory system. All right, as you can see, most common is hypertension followed by diabetes. Some of them already have heart disease, and only quite a low amount of them have are admitted because they already have respiratory disease to begin with. Okay, now I would like to just zoom on obesity and how a lot of patients who are obese are also at high risk of developing severe COVID. So you can see obese hosts actually, they are said to have more expression of this ACE2 receptor. Remember how the virus actually gain entry? So it enters when the spike protein attach itself to the ACE2 receptor and gain entry into the epithelial lining of the respiratory tract of the patient of an individual. So once there is a lot of entry, more viruses can come in. So what happens is that more virus can replicate, and the viral load is high, and what happens, it can mount up more inflammatory response. Okay, at the same time, they can also spread the virus more. Okay, when there is a lot of fat cells in the body, there is a state of um, a lot of inflammatory cells, and when you have an infection, more inflammatory cells will be activated. So this increases a pro-inflammatory cytokines, and when there is a lot of inflammation cells occurring, you can develop cytokine storms. Okay, another thing, people who struggles with overweight or obesity has also what we call a state of immune system dysfunction. This is because when there is a lot of fat cells, the insulin levels are also very high, and leptin usually are high, but patients are resistant to the effect of both leptin and insulin. Therefore, there is impact immunity. So all these three predispose somebody with obese to develop more severe COVID. At the same time, other things that obesity cause is that they cause also respiratory dysfunction. So people who are overweight or obese, sometimes they have impact respiratory mechanism. Some of them have obstructive sleep apnea, some have obesity hypoventilation syndrome, meaning that the ability of the capacity of the lung to expand per given time is impact compared to somebody who does not have who's normal weight or even lean. And because of that, there is increased airway resistance, impact gas exchange, there is low lung volume, and at times people who are obese have more fat than more muscle, so they have low muscle strength. People with obesity also usually have other comorbidities such as cardiovascular disease, diabetes, and even kidney disease. And other metabolic risks that usually makes COVID even more severe. They may also have hypertension, pre-diabetes, insulin resistant, and high cholesterol level. So all these are packages to develop severe COVID. So these are already mentioned. Uh, all right. So in the US, what they saw, sorry, I think the date is wrong. So this is 2020. All right. So over 40% of US adults are susceptible to severe COVID because many of them are also obese, and they can see obesity actually is higher risk than just having diabetes in terms of developing severe COVID. Okay, as you can see, people with lung disease not as much. So diabetes mellitus and obesity has overshot even heart disease as a common comorbidities uh, for patients who present to the hospital with severe COVID. And the heavier you are, the worse your prognosis if you have contracted this infection. So this is calculated according to BMI. So if you have good BMI, probably your admission requirement for hospitalization is lower compared to somebody with BMI more than 35. You can see it's up to 3 times increased risk of needing hospitalization. All right, so that means that people who are overweight or obese have higher risk needing hospitalization, and sometimes these are the predictors of who might need admission and who might be safe to be just home undergo home quarantine. All right. So just I want to highlight hospitalization was 6 times higher and death was 12 times higher for COVID-19 patients with reported underlying conditions. So I've already mentioned these are the risk factors that to look out for. If you already have them, therefore, if you have COVID infection, usually you need to be assessed in a COVID assessment center to decide for admission or stay at home quarantine. Okay, obviously our healthcare system is currently overwhelmed with the number of COVID infected patients, and sometimes this assessment is really needed to see whether you need hospitalization or not. All right, so just to show you the evidence behind that people with diabetes usually the survival is lower versus without. This is just a study showing that done in China in May 2020, they saw that people with diabetes are more likely to die than those without diabetes. Okay, so if you're already diabetes, what should we do to reduce the risk of getting severe COVID? Obviously, some of us patients, even though we are diabetic, our blood glucose control is quite good. So if your blood glucose control is under control, that means between HbA1c of less than 7%, your survival rate is actually quite high. But once the blood glucose level becomes in the teens or more than 10, you have a 11% chance of dying due to COVID. So therefore, it is important to get your blood glucose to control or treat your diabetes adequately so that it becomes a protective in terms of against COVID complications and death. Okay, I've already mentioned this. So now you probably ask me why diabetics are higher risk. So I'd just like to go through with you all again. So type 2 diabetes, people living with type 2 diabetes actually have a lot of inflammation in the body. All right, so that is because of impaired immune response uh, towards an infection. Even before the COVID-19 era, people with type 2 diabetes are more prone to get any form of infection, whether it's respiratory infection, flu, or even anything that is causing usually even pulmonary tuberculosis. One of the risk factor is type 2 diabetes. And because of the comorbidities that occurs in patients with type 2 diabetes, sometimes they have hypertension and dyslipidemia. So when there is more medical illness, there is more chance that when you have an infection, the body weakens even more. All right. So what happens is that if you are also obese, I've already mentioned, it makes the problem even more severe. Okay. And at the same time, other risk factor is that when there is a lot of inflammatory cells, your immune response usually spikes up after developing a COVID. It's because of the this immune dysregulation in most of the type 2 diabetes patients. So another thing that is hypothesized is that people who are obese and with metabolic syndrome, usually the ACE2 receptors are more higher in them. So because of that, there are more virus able to enter a person. And this worsens is that when your glucose level is high, so it becomes more susceptible where the virus can thrive in an environment that is rich with glucose. Okay, and of course, the older you are, that your immune system are also lower, that makes the problem even more worse. Okay, so if you are in any of these, you have all these comorbidities and you are older, therefore you have to take care of yourself better. That's why the in terms of the vaccination, also the hierarchy was frontliners and then those who are elderly. Okay. Okay, so what happens when people living with diabetes are ill? So when people living with diabetes are ill, usually their bodies react by releasing hormones to fight the illness. All right. So we call that these stress hormones. These hormones can be triggered by any of number of conditions such as infection, cardiovascular ischemic events, even diarrhea can cause body to release more stress hormone and even dehydration. So the hormone release the blood sugar level and at the same time make it more difficult for insulin to over there. Sometimes you are ill, your blood sugar level goes up, you may need a short-term course of insulin to get the blood glucose to be normal. For people living with diabetes, even a minor illness can lead to dangerously high blood glucose level, and therefore sometimes they can be admitted due to diabetic emergencies like diabetic ketoacidosis or hyperglycemic hyperosmolar state. Okay, and sometimes they can come in with severe dehydration. Right, so I've already mentioned these two conditions. All right. So what usually we do in the hospital is that when people who with diabetes who are admitted with some illness, we have a target of glucose level that we try to keep it at. So for pre-meals, usually it's usually 4.5 to 7, and 2 hours we don't let it go more than 8 for if it's mild illness. But if the patient is critically ill, obviously there are more stress hormones that is released, so the sugar will indeed go higher. So, but there is also an acceptable level, and these are the levels that we try to aim for people who are ill. All right. So that's the challenge when we are treating people with diabetes for any reason for admission, mainly when they are ill. Okay. All right. So if you have diabetes type 1, there is what we call a sick day rules that we usually go by. So if you're type 1 diabetes and you are sick, what you need to do is you have to regularly check your glucose level. So sometimes up to 2 to 3 hours or as necessary if it's higher or your or if it's showing a trend towards up. Insulin for people with type 1 diabetes usually cannot be omitted because once you omit your insulin, there is a risk of no insulin in the body, and this can cause lead to diabetic emergency, which we call diabetic ketoacidosis. Okay, so usually we have this short-acting and long-acting insulin. So the long-acting insulin usually will need to be continued despite that the person who is ill usually is unable to eat. So don't forget your long-acting or basal insulin. Um, so at the same time, you have to remain hydrated. So if you are having nausea and vomiting and you can't keep anything in, the best thing is quickly go to a doctor. You may need some intravenous fluid resuscitation. But if you're still able to drink, the recommended is to keep hydrated by drinking more clear fluids. Okay. If your sugar are high, please don't drink 100 plus or even carbonated drinks that will make worse your glucose level. Just drink clear water. But if your sugars are low, there is a role to probably add some glucose or take or any drinks that is has carbs in containing drinks inside it. So that the glucose goes a little bit high as you continue to take your insulin. Another thing is that if you have a ketone machine, you should check your ketone level every 4 hours, right? Because if the evidence of ketonemia, that is presence of ketone in the blood, that you might go to the state of diabetic ketoacidosis, and therefore you need hospital admission. Okay, but if the ketone is still not very high, you still can administer some insulin to get the ketone down. Okay? So these are the range if you have a keto meter at home. So anything below 0.6 is acceptable. So between 0.6 to 1.5 indicates the development of a problem that may require medical assistance. So if you can treat your ketonemia by taking your insulin and also sometimes even drinking more or even take some amount of glucose to get the ketone down, then you can continue. But if it goes higher, that is the time where you need to call for help or even go to the nearest hospital. Okay, so the rest of you who's not type 1 diabetes, what can you do? So even at this moment, we know that a lot of people are actually at home or working from home. So there are possibility that their glucose is going up because they are probably eating more than usual and exercising less. Okay, they're not physically active when they're at home. So what happens? The blood glucose can go high. So what you need to remember is that continue to take your medication as prescribed, or probably if you're taking so much of carbs or even sugary drinks, you should cut down on them. And then if you probably don't see any reduction in glucose despite reduction in dietary intake, that is when you need to ask your doctor, hey doc, is the medication enough for me because it doesn't, my glucose seems to be going up. Okay, and many of my patients actually have gained quite a lot of weight in this lockdown period, and some of them actually need to increase their medications, and they probably need to even exercise to burn more of this glucose while they're at home. Okay, so the take home message is reach and maintain a healthy weight while even you're staying at home. Okay, remember the recommendation is 150 minutes per week of physical activity of moderate to high intensity, and don't forget the weight training and resistant exercise as well. As you can see here, lifting up weights to build more muscles and reduce more fat is the way to go. Okay. C is control your A1c. So the acceptable HbA1c for January is less than 7. So if you're still in the tens, that's probably put you in a higher risk of reduced immune function and also making your body less fit. So get it down as much as possible to control. And then if you're a smoker, please try your best to kick the bad habit. As you know, that even smoking is causing more inflammatory cells in the body, and when there's a lot of inflammations in the body already, when you get this virus, your immune system is dysregulated, you can go into a cytokine storms, and therefore when you go into cytokine storms, the COVID infection becomes more severe, the damage that it causes becomes more, and what happens is that these are the people that we are fearful that you might end up needing ventilation in the ICU. All right. So for the rest of you who are also having other diseases like hypertension, high cholesterol, and also uncontrolled diabetes, if you are elderly, sometimes at the age of 65, aspirin would be recommended as a prophylaxis or primary prevention against heart disease or stroke. So you might want to consider aspirin or ask your doctor whether you should be on aspirin. If, of course, if you already had a heart attack or unstable angina or stroke, aspirin is something that you probably will need lifelong. Blood pressure control, obviously, get it down to 140, 90 and below. And some of us may need higher, more lower blood pressure, especially if we have some form of kidney impairment as a complications of our diabetes. Cholesterol, anti-cholesterol medications, a lot of people are still very resistant to taking cholesterol medication because of the very bad publicity that was given to it. Believe me, anybody with heart attacks or stroke, cholesterol medications are the thing that is probably saving them or making them live, continue to live. Obviously, smoking cessation is a must if possible, and some of us actually need to help our patients to stop smoking. All right, that's all I have to say about COVID and diabetes at this moment. I would now take the pleasure of answering questions.
Right. Thank you so much, Dr. Shalini, for the interesting and informative talk. So from your slide and talk, that's now the statistic and prevalence of people with diabetes hospitalized for COVID-19 are very alarming. So Dr. Shalini, may I ask, so what should people with diabetes do to prevent contracting the COVID-19 virus?
Right. People with diabetes, obviously, as I mentioned, are higher risk. So many of them, first and foremost, you should probably, as much as possible, comply to the SOP. If you can, do not go out and do expose yourself to the virus. Or even nowadays, some of my patients don't even remember when they went out and how they got the virus. Okay, so you need to stay safe. Double masking with a surgical mask and a cloth mask is probably the way to go. It is impossible for you to be locked up in the house forever. You do need to go and get your groceries and probably sometimes food. Do go, but then keep safe. And sometimes I think now is the time where you usually should try to use a face shield as well, okay, because the T zone also needs to be protected from entry of this virus. Okay, another thing I believe, I hope so that all of the people living with diabetes have already received their vaccine. All right, so the vaccine is probably one of the main things that you need to have to prevent yourself from getting COVID virus infection and severity. Like any other vaccines, right? It reduces the severity of the illness. It doesn't 100% give you immunity against the COVID virus. So don't think that after receiving your vaccine, even whether completed 2 doses or just 1 doses, you think you're safe. That's what most of the people think. If they are safe, therefore they went out more often, and that then they realize, oh, this COVID, they still can get it and can even spread it. Okay, it only reduces the severity of the disease and the illness, but it does not guarantee you to be COVID free. Okay, all right. So that's another important thing. Obviously, take some supplements if you know that you're a person who's probably have low vitamin D. I can tell you, majority of our Asian population have low vitamin D level, and this has already been backed up by a study done previously that many of us, even though we live in a hot country and we get most sun, if not every day, um, yet our vitamin D levels are low. The question is why we have low vitamin D, because we usually don't expose ourselves to the sun. We are usually covered up. Okay, as you know, when there is lesser skin exposed, that means there is lesser possibility of you to absorb the UV and also the vitamin D. So therefore, our vitamin D levels are low. It is recommended to be on a vitamin D supplements. Even if you don't have low vitamin D, it's always good to continue to have adequate vitamin D in the blood. Other things like you can always protect yourself by taking your vitamin C. Lah. Of course, if you're diabetic, you have to make sure your glucose is under control. If you feel that you're struggling with getting your glucose to under control, or you have very low blood sugar level, this is the time for you to seek consultation and advice from the doctor on what to do. Okay, you don't need so many consultations. 1 or 2 consultations can actually help and make a difference. Okay, and I think is that all? Yeah.
All right. Thank you, doctor, for the words of advice. Okay, so this is the first question from Mr. Ashbakana. So, hi, Dr. Shalini. So, I'm a type 2 diabetic. So, my question is if my blood glucose reading is below 5 millimole per liter during my sick day, should I still take my insulin and tablets to keep the blood glucose at bay?
Hi, Ishwa. Thanks for the question. So, if you are type 2 diabetes, as you clearly mentioned there, and your blood glucose is like below 5, and you're already on tablets, I usually would probably see no reason why you need to continue your insulin if it remains a good control. So, sometimes you can try to reduce your insulin dose and even stop it if it continue to be good. Okay, but having said that, I am not your doctor, so I do not know your medical condition or history very well. So but yes, if you are not type 1 diabetes, you can stop your insulin, but usually the tablets and are probably the one also helping to keep the glucose down. But something below 5 is probably a bit too good, and you might want to see whether you don't need so much medication to get to control.
All right. So before we go on to the next question, for all who are with us live today, you may still submit your question via the comment box below, and please do keep the questions coming. So the next question is from Miss Madam Janice Tay. So hi, Dr. Shalini. I'm a type 2 diabetic and heavily pregnant. Am I at greater risk of severe symptoms, complications, or even death if I get COVID-19? And it is safe for me to take vaccine at this 6 month pregnancy stage.
Hi, Janice. Yes, people who are pregnant usually has a lower immune response. Okay, because yeah, our immunity reduces, during pregnancy, and there is reason for it. Obviously, when your immune system is lower, the risk of severe symptoms increases. All right. Yes, there are many of pregnant ladies who are actually in the hospital, and some of them are in close monitoring in the ICU. So yes, you are at probably a higher risk compared to the non-pregnant counterparts. It is safe to take your vaccine. In fact, we're making it a must for all pregnant ladies to actually take the vaccine. Okay? At this 6 month pregnancy stage, yes, you can still go. All right. So far, we have already put in the three vaccines available in Malaysia is safe to be taken by pregnant ladies. Okay. Yeah. So you can go and get your vaccine immediately.
All right. So thank you so much for Dr. Shalini for answering all those questions. So in the interest of time, I'm afraid we won't go to a small question. Thank you for keeping the question coming, and we seek to answer the rest of the questions by replying to your comments. So we have reached to the end of our session for today. Thank you once again to our speaker, Dr. Shalini, for giving us an in-depth look into diabetes and COVID-19. So please don't forget to like and share. Until next time then, so stay safe, stay healthy, and always remember to keep your diabetes on track. Thank you.
Thank you, I know, and thank you everybody for your kind attention. Stay safe.